Hi, I'm Derek McCammon, podiatrist and foot and ankle surgeon with Advantage Orthopedic and Sports Medicine. I thought I'd give you a little shout out to the old ankle sprain. The typical ankle sprain is significant. There's mild, there's moderate, and there's severe. The average person with a mild ankle sprain, which most of us have probably had at some point, we don't usually see those because within a few days to a week or so, we see improvements and no long-lasting effects, it seems like. The moderate to severe, though, frequently drives you to an urgent care, to your primary care doctor, to our office, to the emergency room, because many times we think that we broke our ankle. The typical sprain is what we call an inversion ankle sprain, and the foot rolls into basically a high arch position, and that creates pain on the lateral or outside aspect of the ankle most commonly. You can have a peripheral sprain, though. You can have pain all the way around the entire circumference of the ankle joint. If you're able to weight bear after you do this, pretty good chance you didn't break anything, but you can still have small chip fractures, etc. in there that allow you to bear weight. But many times the x-rays are helpful to rule out a fracture. If you have a fracture, many times we still treat it as a sprain. The sprains typically start with treatment in the realm of RICE, rest, ice, compression, and elevation. There's a lot of different ways of doing that, obviously, but as far as immobilization, we use functional ankle braces similar to the sport braces that you'll see out on an athletic field, lace-up, Velcro style devices. The more severe sprains where you're unable to fully weight bear and significant limp is involved, will put you into what I call a fracture boot or a functional boot, otherwise known as a cheater cast, to allow you to weight bear, but to kind of immobilize all the tissues, including the soft tissues, bones, joints, muscles, etc. If lingering pain happens, we end up going to an MRI frequently because there are a lot of side effects to the ankle sprains that show up over the course of healing. The sprain may be healed, but we may have tendon injuries, we may have cartilage injuries, muscular injuries, and even chronic bone bruising is frequently seen, and that can linger for months, and it does sometimes lead to a surgical discussion. It is very, very important with almost all sprains, especially the moderate and severe, to at least have strong consideration and discussion with your physician to consider physical therapy. The ligaments of our body are very important for the sense of balance, otherwise known as proprioception, but we have to retrain these ligaments to get you to a functional status so that you don't do this again and again and again and lead to deformity, chronic pain, sense of instability, so that you could be walking down the hallway on a flat surface and roll your ankle. You could be in the grocery store and fall and roll your ankle. That is not good. So those of us here at Advantage Orthopedic are more than able and very happy to see you if you have one of these injuries. Please come see us.